say, every time we do summits, we always have to remind ourselves, and it shouldn't be that way, how important, how essential our nurses are to everything that is done. The level of care that they provide is really what lifts that medical institution. It lifts that doctor's office. And often they don't get the praise that they deserve. So let's do it now. Let's show them how much we love them. We actually had Sandra Lindsay, the very first person in the United States to get the COVID vaccine. And what was she, ladies? An African-American nurse. All right, so we want to thank the Greater New York City Black Nurses Association. Woo. They have a table in the rear and are offering screenings for blood, glucose, BMI, hypertension, and Narcan training. So thank you all for volunteering of your time. Now I will introduce you to the moderator of our next session, Nurses on the Forefront of COVID and Mental Health. This is a discussion about the pivotal role nurses play during a worldwide health crisis. The moderator for this session is Dr. Kellie Dionne Bryant. Dr. Bryant is currently the Assistant Dean of Clinical Affairs and Simulation and Associate Professor at Columbia School of Nursing's accredited Helene Fould Health Trust Simulation Center. Dr. Bryant has over 20 years of teaching experience and 10 years of experience as a women's health nurse practitioner. Additional responsibilities include implementing initiatives that promote diversity, equity, and inclusion for students and the New York community. Take it away, Dr. Bryant.
All right. Thank you for that wonderful introduction. Good afternoon, everyone who's in the audience and those of you watching us virtually. It's a pleasure to be here today moderating on behalf of the Greater New York City Black Nurses Association on Nurses on the Forefront of COVID-19 and Mental Health. So I'm here today joined by my wonderful colleagues, and I'm going to take some time to introduce each one of them. To my immediate left, I have Tanya Moore-Murray, who is currently the Assistant Director of Nursing for Ambulatory Women's and Children's Health Services at Jacobi Medical Center in New York City. A nurse with 20+ years of experience, specializing in various aspects of women's health services, and she currently serves on several committees at her hospital. In addition, she's held roles in quality improvement program, implementation, research, and I was surprised to see even simulation, and obstetric patient safety. She's a preceptor for our RN students, the graduate students, and she's also a member of Association of Women's Health, Obstetrics, and Neonatal Nursing, and a proud member of the Greater New York City Black Nurses Association. So welcome, Tanya. And then next we have Jewel Adams. Jules is an experienced nurse leader with a passion for serving underserved communities. She's a graduate of Emory University with a master's as a family nurse practitioner and an undergraduate from the University of Phoenix. She currently works as a director at St. Barnabas, which she just started last week, so congratulations. And she is also a member of GNYC and the past treasurer. And last but not least, we have Dr. Kimberly Ennis, who is an experienced clinician and leader who is passionate about mentorship and helping others. She is currently a senior director of nursing at Mount Sinai, Queens, and she was elected as the first vice president of Greater New York City Black Nurses Association. She's an active member of several professional organizations. She supports through committee involvement and community service outreach initiatives. She earned her bachelor's and master's from State University of New York at Buffalo and a doctorate in nursing practice from Yale University. In 2020, she was nominated and awarded the Business Council of Westchester 40 Under 40 Rising Star Award and National Black Nurses Association Administrator of the Year. Please give a round of applause to our wonderful panel. All right, so we're gonna dive right in. So we know that during COVID, you all played various roles in the hospital setting. Can you tell us just a little bit about what it was like working as a nurse or nursing administrator during COVID? And I'm gonna start with you, Tanya.
I I would say, of course, it was very difficult. Each day, you're not knowing what it is you're actually going to experience. I want to first say I would like to take my hat off to all of my colleagues who were actually on the front lines, meaning the ICUs, the ED, in the hospital itself. Because I'm in an ambulatory setting, it was a little different. And a lot of our services were closed down. But then, because we were available, my staff went into the actual hospital and helped. And so just trying to be supportive of them and anyone else in the hospital was a task. And of course, being in the Bronx, that was really hard hit with COVID. Each day was, you just didn't know what to expect, but just praying and trying to be a team leader as well as a colleague.
Great. Julie, would you like to add on?
Yes, as a nurse manager of a med-surg unit, I was actually at the Bronx and Montefiore Workfield at the time. We set aside a few beds for the COVID patients, which quickly turned into our entire hospital filled with COVID. So it was kind of like a tsunami coming over us. It's really hard to describe what we went through at the time.
Great. And Dr. Ennis?
So for me, at the time, I was an associate director in my organization, and I was involved and in charge of helping open the first designated COVID ICU. And I never forget the call that I received on March 9th at 9:30, what would be happening the following morning. And I didn't really know what to expect. It was the unknown. We knew COVID was out there somewhere in California. We weren't sure exactly what that meant for us and for nurses. And delivering the news, I will never forget to the staff that we'll be, transforming into a COVID ICU, and telling them at the time, you don't really need a mask, and really keeping up throughout the pandemic with the various different guidelines was difficult, because you're not sure what to believe yourself as a leader, and you just have to deliver the messages to the nurses you're leading and to the staff you're leading, and ensuring you're doing right by them. And as the pandemic went on, it got difficult. So I just want to give you a quick perspective that you may not know. A nurse could go a decade and never see a death, right? A nurse in an ICU may experience, because again, depending on the shifts that you work, may have a death maybe once every month. And again, there may be several deaths in an ICU, maybe 3 or 4 for that month, depending on the acuity of the ICU. But nurses were experiencing a tsunami of deaths every day for weeks, for months on end. And think about how that plays on your psyche, right? And we just have to keep going, right? So the experience within itself, it was very traumatic. And at a time, we weren't thinking that. It was just that we just have to do. We just have to keep going, right? Whether it's, everyone has a different reason why they kept going, whether it's for your family, whether it's for your community, and whether it's for each and every one of you sitting in the seat. Right? So it's a very traumatic event when we sit and reflect back on it, but at the time, it was that we have a job to do, and we just have to keep going. And for me, I will never, ever forget the experience. I will never forget the dates and the calls that I got. I will never forget sitting there, and standing there, I should say, and telling my staff what we're about to do, and not really sure myself as a leader what exactly we're doing, but knowing that we're going to do it as a team. And for me, and something that I lived by growing up, that whatever it is that's coming, failing wasn't an option. And as a Black woman, as a Black nurse, I've always told myself that, and I carried that mentality throughout COVID. Whatever it is, I can't fail. I can't let myself down. I can't let my family down. I can't let my team down, and I can't let my community down.
Great, thank you, Dr. Ennis. So we hear that there were a lot of long hours. You were all in leadership positions, so you're not worried about yourself, but you're worried about your staff, your floor, and you're worried about the patients, and you're dealing with life or death every single day. And then on top of that, no one mentioned, I'm sure you were worried about also coming down with COVID-19. So how did you deal with all that stress and those worries, and how did you get up every day and still persevere and go to work? And this time I'll start with Jewel.
So for myself, just thinking back, I thought about my team. I thought about my family. I thought about the community of the Bronx. Who else is going to be there to do it? This is a calling. Nursing is a calling. You don't just go into nursing for the money, because what they pay us is priceless. What we provide for the patients every day is priceless. So it was about a sense of purpose. It was about being able to share with loved ones who were on the phones, how is my family member doing, reassuring my nurses while reassuring and hugging myself to get up the next day and go back to work, and then coming home to my husband who worked for MTA and who was thinking, really, you're going back to work? And I said, yes. You know, if we don't, like Kim said, who else is going to do it? Not only seeing the patients and the families and my colleagues, but my colleagues were falling ill as well. So I felt like we had to be there. If I was strong enough to be there and I was well enough to be there, I needed to be a part of the solution. So that's what kept me going.
Great answer. Thank you, Jules.
So I think one of the things that also kept me going, it's the Black Nurses, Greater New York City Black Nurses Association. We had webinars, we had town halls that as Black nurses were able to connect. Again, we were the hardest hit community. So it was a forum for us to be able to open up freely and talk about what was going on within our workplace, within our community, within our families, and we were also isolated. So imagine you have this this pandemic, you know, this I call it tragedy also going on, and being isolated, right? So having that forum to connect, to be able to vent, talk, come up with solutions, ideas. What are you doing? What are you not doing? What worked for you? What was it kept me going, right? And to know that you're in this together, and you're not, you know, it's not something that you're dealing with siloed, although you are, you know, isolated. So that was something that really helped to keep me going, having a strong community network from our nurses that looked like me.
Yes, that was very important. I remember the late night Zoom calls that we would have, and just to debrief and just talk about our day. Not looking for any advice or anything, but just the vent was very important.
So for me, as we all know, being a leader is difficult. And I remember, I live in New Jersey, right across the George Washington Bridge, and if anybody knows, like, that traffic every day is ridiculous. And I was going across the bridge one day during COVID, which of course there wasn't as much traffic, and it brought me back to 9/11. I lived in New Jersey, and I was trying to get over the bridge, and I had to show my ID as a nurse to get over the bridge. So it brought me back to that, and I was like, again, like Jules said, it's a sense of purpose. If I don't do this, then who will? The other thing was that we were my hospital was one of the first ones in the Bronx that got hit because patient 0, who was actually from New Rochelle, went to the same synagogue as some of the doctors in my hospital, as well as 2 of the providers that I worked with was actually related to him. And because I live in Teaneck, New Jersey, which also has a very large Jewish community, we were hit hard then too. So it was all connected. So one of the things that I did was try to kind of do things for myself at home, try to have my husband give me a massage, or I started having massages again once I could, but just taking Epsom salt baths and things like that. In addition, in trying to help my staff do little things for them, like before, you know, every day was like, oh my God, where am I going today for them? Because they didn't know where they were going once they got into the hospital. So we would bring in like little snacks, individualized snacks for them. On Thursdays, we would have meetings. But one of the things I can honestly say that our hospital system did once we got really hit was to provide outlets for us at work. That was important. They had, so we would get donations from everywhere. You know, they would provide lunches for us. We had a little Zen room that we give out little snacks. And then as COVID went on, within the hospital itself and of course the corporation, we have a group called Helping Healers Heal, where people from different groups, if I'm in ambulatory, I would go to the ICU or I'd go to psych, and we kind of connect with the people and the patients there and give them little books and things like that. So that kind of built everybody's morale, even though of course you hear the RRTs and the CACs all day long and you know what's going on in the EDs or in the ICUs. So these are things that helped me, and of course prayer. That's what got us through and still continues through with all of this, because as the folks on the prior panel said, this is a part of our life now. So what do you do? And how do you keep recharging yourself in order to mentor others, in order to empower others? It's difficult.
So you sort of went into my next question, which this whole focus is about mental health. So I want to know specifically, if you can share, what were some of those self-care things that you did after a long day's work when you were stressed and you were tired? What did you do for your own mental health? And I'm going to start with Dr. Ennis.
So I'm going to be honest, you know, throughout COVID, I wasn't thinking about my self-care. And it really aligns. I mean, it was a lot worse that 70% of nurses actually put the care of their patients and families and community first, right, based on surveys. And I'm pretty sure during COVID that probably reached to 100%, right? So I wasn't doing a good job at that. But as things calmed down, I started to think about what am I doing to make sure that I'm okay. Because if I'm not okay, my team's not okay, you know, my community's not okay. The patients we care for and we work towards making sure their health, physical and mental health is fine, won't be okay. So the first part of that, though, is recognizing that you need self-care. That's the first part. What am I going to do to recognize that I need to stop and provide care for myself? And the first thing is you need to ask yourself, what am I doing one time a month, maybe one day or a couple hours a month for myself? Ask yourself that. But I'm actually going to switch it around a little bit. Raise your hand if you know a nurse in your community, your neighborhood. Just raise your hand in the audience, right? I want you to do something for me. When you see that nurse, ask them, what are you doing once a month? And ask them what it is to ensure that they're caring for themselves, whether it's a spa treatment, whether it's just to sit by the lake and for an hour. You have to be deliberate, right? Deliberate in what you do. And what I've learned for me that I've started doing is disconnecting. Take a moment, turn off the phone, go under the covers and disconnect from everyone, from your family, from work. Disconnect. And I've learned how beneficial that is for me, right? But everyone has something different that they like, and you may choose for self-care. But the first thing is recognizing that I'm not taking care of myself, that I'm not taking care of my mental health, right? So figure out what works for you. Again, it could be a spa treatment, it could be venting, it could be finding an organization that have people that look like you to talk about the issues that you're going through. There's various different modalities for self-care, but you have to figure out what works for you. But the first part, I want you all, not only the nurses, to ask yourself right now, at this current moment, what do I do once a month? I'm just saying once a month, it should be more, for myself and myself only. If you can't answer that, then you're not providing self-care.
Great, thank you. And let's give a round of applause for that. Jules, I have a different question for you.
Okay.
So we've talked a lot about all the difficulties and the challenges, but now I want to switch gears. Were there any moments during this pandemic where you thought to yourself, I'm really proud that I'm a nurse? Can you remember any times where you had that feeling?
That's a good question, because I saw so many heroic deeds, so many little things that nurses, nursing assistants, and doctors were doing that it could fill this room. It doesn't take a lot. I remember one day a patient's family member called, and she said, I just want to know how my daughter is doing. They say we can't visit, we can't come into the room. And I said, you know what, let me go in there and check on her. She said she won't answer the phone. And I said, look, your mom is calling you, why aren't you answering the phone? And she said, well, I was trying to get something to eat, and you know how things in the hospital are things you do, and I can call her back. So I went back to the phone and I told her mom, I said, she says she's gonna call you back in a few minutes. And she said, you know that's my baby. And her baby was 35. So I said, you know, my baby is 39. So I completely understand. So I spent a few minutes just sitting there talking to her, reassuring her that her 35-year-old baby was gonna give her a call in a few minutes. She was one of those patients that did survive, and just moments like that where I saw my staff connecting with patients and motivating them to breathe and to move and to, you know, do the best that they could to survive. Those moments I'm most proud of. Thinking about the mental health, self-care, those things recharged me. When I saw a nurse breaking down and feeling like, you know, it was too much, I would take people aside and say, you know, there's no S on your chest. You can stop. You can ask for help. You can take a moment to breathe, to eat, to just go in the stairwell and cry, you know, if that's what you needed to do. But the whole experience, some people may feel like, oh, we failed, but no, if you were there and you saw all those tender moments where we reached out to patients, to families, to coworkers, I am just truly amazed at the profession of nursing, how we stepped up and did what we needed to do.
All right, thank you, Jules. So I see we only have a few minutes left, and I want to make sure I leave enough time if there's any questions from the audience. So if anybody would like to ask our great panel any questions, please come up to the microphone.
Just a quick question. Thank you so much for your service. We couldn't do it without you. New York wouldn't be here without you. I wanted to say that. Nurses Appreciation Day is coming. So could y'all give us a few tips on what would make y'all feel appreciated? Not what we want to give y'all, you know, something that y'all would feel appreciated for Nurses Appreciation.
Bring us some good food. Or the floor.
I'm gonna say one thing. Nurse Appreciation Day is coming up. The thing that I would love to see is, I would love to see our community take control of your health. You know, take that advice of the nurse, take that information and use it to improve our health in our community, because it's a big issue. We are the ones who see most of the diabetes, most of the hypertension. We're the ones that are suffering from the disparities. So take the information that we're sharing with you and use it. I would be most appreciative not to see you in the hospital.
That's a very good one. And I'm just going to piggyback off that, actually, Jewel. One of the, for me, and most memorable things is when a patient comes back and said,
remember that the teaching, the education you gave me regarding the diabetes and the hypertension like 2 months ago? I've lost weight, my pressure is this, I'm off my medications. Share those stories because, I mean, the joy it brings the nurses or your healthcare providers is a true thank you. It's like, oh, I didn't do that. It was purposeful. It was great to hear the feedback. So that's really a good tip. And food is also great.
Absolutely.
I just want to say thank you for your work, because without you guys, we wouldn't be around. The doctors, they do their thing, but the nurses keep the floor together. You guys put through all the orders. I have many nurses in my family. My sister's a nurse, several cousins, and you guys should definitely get your salaries doubled. I hope you guys got a raise throughout all of this. And what is your employers doing to help you with your mental health? Are they offering you guys any assistance in that? Because this is mentally taxing on you, going through all of these deaths every day. Today someone's alive, tomorrow they're gone, and vice versa. So are the employers helping you guys out with that?
So I thought I answered some of this before, but in my facility, we do have the Help and Healers Heal, but we also have a hotline for folks if they feel that, you know, there's some extra help they're needed, or if we know that there's plenty of staff that I have referred to our employee assistance program because I know that they may be having some difficulties with certain things. In addition, we also have providers that provide the helpline for them. So I really must say I feel that our corporation, and I work for the City of New York, has really stepped up during COVID and assisting our staff as far as mental health is concerned.
I definitely feel the same. I think prior to COVID, mental health wasn't at the forefront of a lot of organizations' mission and vision and goals. And I feel very well supported. The nurses and employees in my organization feel the support. There is a recharge room that they have. We have pet therapy it was a lot before for patients. Now it's for staff as well. We have hotlines. We have nurses we have eye care groups. I mean, there's yoga. There is various different activities to help you. And it's virtual now and in person. So there is tremendous, I think, effort being placed from healthcare organizations to ensure that staff are mentally okay compared to what I've ever seen prior to COVID. So I do feel the support. There's always more that can be done, but I think they've stepped up big time and recognized what's going on.
All right, we'll take one last question and then we do need to wrap up.
Hi ladies, I'm Victoria. I've been a registered nurse for 11 years at the bedside. So, 2020 was traumatic, but 2021 I felt we in the hospital kind of got used to COVID. So it was like administration was just like getting back on us hard because they kind of were a little lax, during COVID. So then my colleagues and I began to feel not important from administration, the higher ups. So since you are administrators, I would like to know what are you doing to just remind your staff nurses that they are important in their field? Because as we're burnt out, we're going through a lot.
Okay, so let me make sure I rephrase this question. You want to know what we're doing to remind our staff that we are important as nurses?
Yes, from an administrative standpoint, because as a floor nurse, I began to feel that those higher up in the C-suite were just not considering us as important anymore. It was like, that's just how I was feeling. So I just wanted to know, you as administrators, how are you giving life to your staff, basically, after burnout?
That's a good question. I think we're in the process of actually recognizing the staff. The year of the nurse was 2020. They actually repeated that, the year of the nurse, and I think that COVID identified some things that we were not doing well, and one of them was recognizing that nursing is the biggest part in the hospital. We're the largest budget, and we're the ones that make the biggest impact. So I think that's something that we're going to probably investigate more on how we can do a better job in recognizing the nurses.
All right. So we have run out of time. I got the sign, so we have to end. So we want to thank everyone who's in the audience, who's watching us virtually. Thank you for participating in our panel. And please follow us, Greater New York City Black Nurses Association, GNYCBNA. We're on Twitter, we're on LinkedIn, we're on Instagram, and we will be out if you have further questions and you'd like to speak to us. As soon as you go out into the walkway, we're over to the right. So please feel free to stop by if you have other questions for us. So thank you, everybody.